Right, everyone. I hope you're doing well. My name is Dr. Ndidiamaka Bareke. I go by Didi. I am the president and the owner of Olive Tree Compounding Pharmacy. I'm here today with Dr. Roman Romero, the director of clinical services here at
Hello.
Olive Tree Compounding Pharmacy. And today we have another Get It Together session. How are you today, Dr. Romero?
I'm doing good. Very excited for our Get It Together. Really
Yeah.
enjoy these each month. They're great.
Yeah, I mean, honestly, this is a topic that there's a lot of inquiry around it, from provider to patient. So many people have been asking us, like, what do I do now? Whether it's because the FDA has declared that medications are no longer in shortage, or it's because we have a lot of clients who've reached their goals. So we thought it necessary to put this discussion together so that we can, reach some of those inquiries with some answers. Basically, we really want to come to the table with answers. We want to help people progress beyond the therapy that they've used, perhaps for the past 2 years. So let's go ahead and talk about, what happens when these patients reach, maintenance. What are we doing for these patients? What are you doing for the clients that come and seek your expertise?
Yeah, no, I think great question, especially for the patient that's, pre-diabetic, they're not diabetic. And at the end of the day, these are diabetic medications. So, talking with them about what other factors in their life we can correct, such as hormones, what type of support do these patients need when they're looking at coming off the GLPs? So, are we looking at controlling hunger, helping out with appetite cravings? Are we looking at with just promoting the current weight loss that they've got and maintaining that weight?
Mhm.
Really, that's what we're looking at and finding safe whether they want to stay on the medication, telling them what that would look like or giving them other options to further support them.
Exactly. Yeah. I know one of the biggest things that we do here is hormone replacement therapy. I think a lot of patients don't really understand that that is like a foundational therapy. And if you don't have that, it's almost like nothing else works. Even with the GLP-1s, like these are miracle drugs. These have changed people's lives. But what you find is that once you get into that maintenance stage, if you have any type of imbalance in your hormones, that's when things start to fall apart again. So like what do you target, when it comes to hormone replacement therapy? Is that something that you recommend or?
Yeah, definitely. I think, it's important to let the patient know that a lot of times, the GLPs work, and patients see tremendous weight loss with them. But when they don't fix the other things and they come off the medication, the weight just comes right back off. And you'll hear
Mhm.
horror stories from patients talking about friends or themselves, and it actually comes back worse in what, I've experienced. So yeah, number one is telling him the number one most important thing is let's look at your hormone levels. Then let's go through that subjective analysis. Let's put it all together for you and get those corrected and remind people it's just returning them to the optimal levels. So not going
Exactly.
above, just right in that therapeutic window of where they need to be for a healthy, functioning adult of their age.
Exactly. Like for instance, I know a lot of clients that I see, especially women, they talk about, man, these sugar cravings are, they're like taking over my life, and it's like, yeah, sugar cravings will do that. But a lot of that stems from an imbalance between progesterone and estradiol. And so like if that's not balanced, you're gonna have sugar cravings all day. It doesn't matter, whether you've used the GLP-1, you've now reached your target weight, you come off of that GLP-1 or you titrate down. If you don't have a balance between those hormones, it's going to hit you hard and you're probably not going to feel good, because just like you said, the weight will come right back.
Yeah, and I think really importantly to say, not only will they not feel good from that balance and have the cravings and everything, it's also stress. Their body's more stressed out. So now they're, stress eating. They're looking for those outlets that are not good and lead to the weight coming back, lead to not being able to maintain it. So there's just a lot of things people don't realize that having optimal hormone levels help with inflammation, stress, just helping for overall optimal health.
Exactly. How do we support natural GLP-1 production? Because I think a lot of clients, they may not even understand that our bodies naturally make, GLP, which is a hormone or an enzyme, a protein, however you want to look at it, right? Um, I think a lot of patients don't understand that our bodies can naturally do it. So what things do you recommend, Dr. Romero, that help our bodies to naturally produce GLP-1, whether we take it exogenously, so like a vitamin, a supplement, or like what can we do to just naturally produce the production of it?
Yeah, great question. So it's important that we educate patients on the fact that the GLP and the GIP, which are the common components of the drugs on the market today, they're peptide hormones that are made in our small intestine.
Hmm.
So telling them that the biggest thing is optimal gut health. You need to
Yep.
have a healthy gut to absorb all these vitamins, nutrients of eating a healthy diet, of being able to intake the protein to support muscles to prevent, muscle wasting that happens to a lot of patients. So it starts with the conversation of a healthy gut.
Hmm.
And then from there, we're, looking at detox programs. Are we making sure the liver's functioning optimally? Now the
Yep.
kidneys. So it's putting it all together, looking at all the organ systems that are vital to absorbing the nutrients and dietary free factors we need to increase those normal production of those peptides that are found in our small intestine.
Exactly. Yeah. Even like using the amino acid, like let's say glutamine, like that's amazing for fixing up those tight junctions in the intestinal tract, and so like when we see patients that have leaky gut or some of these other issues that lead to like autoimmune and inflammatory processes, I think it's important for those patients to know that if you have leaky gut, like you got to seal those tight junctions, to make sure that nothing is getting through and causing other chronic disease, which kind of leads us into, the next little subcategory that we wanted to talk about, chronic disease management. I feel like a lot of patients who are, they're battling with, obesity and, morbid obesity, a lot of these patients also are inflicted with inflammation, this massive inflammatory process in the body. Well, one of the ways that that can start is through leaky gut, so I like what you said, like making sure we have balanced gut health, by eating the right things, by taking the right vitamins and supplements, but then cross that over into preventing inflammation. So I think post GLP-1 therapy, I think one thing that has to be addressed is reducing inflammation and keeping it low, and getting rid of inflammation. What do you think about that?
Yeah, no, I think great, having to look at the patient holistically, the big picture. We can't just forget that, okay, there's a pre-diabetic patient that was overweight and now they lost weight and their A1C looks better and their triglycerides and their blood pressure, but now they're going to go without that medication. So finding them other avenues and outlets naturally that can support the other comorbidities that they'll still have,
Mhm.
so making sure their triglycerides continue to stay low along with their cholesterol, bringing up that healthy good cholesterol, and then supporting their cardiovascular system, and then
Mhm.
giving them natural supplements that'll help with the insulin sensitivity that they were getting from the GLPs. Because at the end of the day, that's what they do. They're glucose dependent drugs. So we can't forget about those factors in these
Yep.
patients.
Yep. Glucose dependent drugs, and then also they combat the insulin resistance, I mean,
Exactly.
that's major. I kind of feel like it's almost like people who come through our door, like there are two things that you can automatically suspect that the patient is dealing with, right? Inflammation and insulin resistance.
Yeah.
you know and once we target those, we start to see like a huge difference in the patient's lives. you know um what I kind of wanted to do was like go through a list of different medications slash vitamins slash supplements that we've heard about, that we've come across, people that come into our doors and talk about them, or the research that we have done as the experts in this field and in our practice. But just kind of go through like that list of drugs and what that kind of looks like. So the first one I want to mention is retatrutide. you know I mean, we've had phone calls, we've had people email us, in person, ask us, hey, do you have this peptide? And I'm like, oh my goodness, like how much more deep are we going to go with GLP-1 therapy? Semaglutide is great, tirzepatide is even better, and then retatrutide, you add that to the mix, and it's like morbid obesity or obesity crisis in America is gone. Because like these three, they just fix everything. And then we also have the liraglutide as well. But so those are a GLP-1 therapy. But now if we look at, like one of the grandfathers, right, of fixing insulin resistance, of fixing blood glucose, metformin. That's still a really good drug, right? Metformin, and then you look at berberine, kind of does the same thing as metformin, basically the same thing. But then like some of the other drugs, like if I were to throw naltrexone at you, like what would you say about low dose naltrexone for weight loss?
Oh, I mean, I
Or
think
not
it's
just weight loss,
tremendous.
but weight management.
Well, I think everything. It's great for inflammation. It helps prevent the inflammation cascade from starting, which is gonna, you even think about just weight loss, it's gonna help with that, but also getting the patient to have a healthy lifestyle to where they can move, they can be fit. It transitions to everything with weight loss, not only just from eating less.
Yeah, exactly. And then bupropion.
I I mean, bupropion, it gets widely used, but I wouldn't say I like it for weight loss, not at all.
Yeah, yeah.
Um,
Just because
yeah,
I mean, yeah, it wasn't even approved for weight loss.
no. Mhm.
Yeah. Okay. What do you think about topiramate?
Same thing. I mean, we're using a what approved Caesar drug for weight loss.
Mm-hmm.
Definitely don't like it. There's alternatives, and that's what
Yeah.
we're educating, the public on.
Yeah. One of the older ones too, that's fairly popular, phentermine, you know, phentermine, that's one that's used, a lot of side effects though, but people do have good results on it. This is one that we actually don't hear a lot about. It's the tesofensine. This one is actually a really good drug as well. Except for those patients who have any type of cardiovascular disease, those are the ones that we really want to watch out for, because tesofensine can cause an increase in blood pressure, so we do have to be careful there. But tesofensine is also a good one. It has to be compounded. When you start to get into those combination drugs, like your bupropion with your naltrexone, or your topiramate with your phentermine, that's when you really want to come and see your compound pharmacist, because we can make those combinations, and specifically tailor them to the patient. So if the patient can't use what's commercially available, we can alter, strains and alter doses, to make it, comprehensive for the patient, and make it easy therapy, basically. And then, the next thing I wanted to talk about with you is black market peptides. I think that a lot of our clientele, people in our community, they're not really understanding that a lot of these medications and peptides and injectable products are actually not FDA approved, and they're not commercially available through a pharmacy. And so they go on the black market. The other day, I actually called just a random company who had a website up, and I just wanted to find out, like, hey, where do you source, your peptides? And the person who supposedly was the owner of the company had to put me on hold and ask someone where he sourced his peptides. That should be a clue to any consumer that, hey, this is probably not the safest thing to do for the body. You're really putting yourself at risk. You're going to expose yourself to endotoxins. You can expose yourself to, solvents and different chemicals that can put you into kidney failure, and, maybe expose you to some type of, septic process. So what do you think about black market peptides?
Yeah, great to bring that up. I think there's a lot of misconception out there with the public and everybody from providers down to patients. They're just hearing, oh, my buddy's on this, my friend is on that, and this is how it works. And they don't realize that with them not being approved and on the black market, they're
Mhm.
being made in laboratories that could be out of someone's garage. They're not inspected.
Yep.
They're being made with components that may not even be FDA approved, have certificates of analysis. So you don't even know what components, what other added ingredients are going into those. And then you're taking that and injecting it. So just like you said, not only risk of sepsis, you can have an abscess, you can get fungal infection. There's a big reason why these are inspected by your local boards of pharmacy and
Yep.
then bigger agencies. So, that's important to really convey to patients for a safety factor.
Exactly. Exactly. I love that. I mean, we even had a provider. I mean, actually, not even just one. We had a few providers ask us about, peptides that are not FDA approved. Like, hey, can you make this? And it's like, no, absolutely not.
Exactly.
Now, but here's the thing. Dr. Romero, there are 503A pharmacies that are making these peptides, you know, and you have to wonder, like, would you really risk your entire livelihood? Or maybe it's not their livelihood, right? This is certainly my livelihood, and I'm pretty sure you can say the same, but we are not willing to risk, you know, our livelihood or even the safety of the patient, you know, the safety of the consumer, just so that we can make a quick buck. You know, I mean, the law is the law. You still have to follow the law. You still have to abide by the rules and regulations that govern the practice of pharmacy and compounding pharmacy. You know, so we over here, we like to stay as safe as possible. With that said, Dr. Romero, if you have any additional comments, I do welcome them. But if you don't, I would love to open it up. I think I saw a question come through in the chat, and then we can kind of just have a discussion about, you know, what our participants think about, you know, what happens after GLP-1 therapy. So the first comment I see here, oh, okay, I see one comment that says, what a great connection between hormones and weight loss, GLP-1 medication or not. Exactly. Yeah, that's what we talked about, Dr. Romero. You know, hormones, weight loss, they go hand in hand. You can't have one without the other, right?
Exactly, yeah. And patients don't realize how much of a extra burden they have when it comes to weight loss by not having optimal hormones. And that's whether it's like we said, maintaining weight or even helping you to lose even more weight. We do have patients and we've seen them, Dr. Didi, where
Mhm.
they've been on max dose GLP and they're still not losing weight.
Yep. Yep. Yeah, definitely possible, you know. And then those are the patients that you really have to sit down and have a consultation with because, you know, perhaps they're drinking their calories, right? Just because you don't consume a steak and a potato doesn't mean that whatever you are consuming is not contributing to, you know, weight retention. Right. So like if you're going through Starbucks and you're getting a venti caramel latte with all the extra pizzazz on top, those are calories and they're empty calories. Right. So what's going to happen to your muscle? What's going to happen to all your entire metabolic processes? You know, that's certainly going to be affected. So, you know, we have to be careful there. Hormones are extremely important, and I think here at Olive Tree we stress that. Like everyone knows that that's what we're known for: hormone replacement therapy. Here's a question: can you explain how LDN for weight loss for a weight loss patient not on a GLP-1 medication can actually? Sorry, let me see. Can actually something help, I think, the body manage weight. Yeah. So that's kind of what we talked about, right? So low dose naltrexone really helping to combat the inflammation. It helps to silence like the food cravings, especially when you combine it with the bupropion. But Dr. Romero, what's your experience with LDN? If we can kind of go back and talk about that a little bit more.
Yeah, my experience with LDN is, with a lot of the GLP patients, and this is called like post-market data that we get. So now
Mhm.
that the GLPs have been on the market, there's a lot of new indications being seen, some small surveillance being seen that they really work well for inflammation and they
Mhm.
help people with autoimmune conditions. It got approved for sleep apnea. So what we are seeing and taking from that is patients need a lot of support when it comes to that inflammation cascade
Yeah.
and all the inflammatory processes that happen in the body. And when a patient is in that heightened state, it makes it hard for them to get up in the morning and not be, without being in pain. They can't function properly. They can't go to a gym, they can't exercise, then they're stressed, then they're eating bad, and it just turns into a whole cascade of events when it's
Yeah.
just simple as inflammation.
Yeah. Yeah. And yeah, I like what you said that it kind of just like it's like a snowball effect, you know? And here's one thing, here's a notion. A lot of people tend to think that inflammation is something that can be seen. You know, we're talking about the inflammation that you actually cannot see, you know. And if you can see it, it's like it's late in the game, you know. You want to combat inflammation in the very early stages, you know. And so I think that's the benefit of LDN. And I like what you said, you know, the autoimmune disease, the fibromyalgia, the migraines, like all of it. You know, LDN to me is besides GLP-1s, LDN is kind of like that miracle drug. I tend to think of LDN as a miracle drug. I myself, I've tried LDN. And you know, one of the main side effects that's talked about with LDN is these vivid dreams. And I think I was telling you, Dr. Romero, there was one night where I was just, you know, just about falling into sleep, and I saw a firework like go off in my right eye. And I guess that was like the LDN working. But or maybe that was like the vivid imagery, you know, that is often reported with LDN therapy. But LDN is a great one. And I almost feel like, you know, if you've gone from morbid or just, you know, morbid obesity or obesity down to your goal weight, you know, LDN is one of those maintenance drugs that you should automatically be on, you know, and it does take a titration. So like there's not a one dose fits all. It does take a titration to figure out, you know, what is the best dose for the patient. But LDN is phenomenal.
I agree. I
Yeah,
agree completely.
definitely. Of course, our previous chat, we talked about vitamin D. We will never ever let go of vitamin D. Like that's something that's near and dear to our hearts. You know, vitamin D is amazing. Really, really. I mean, I always recommend 10,000 international units once a day, 4 to 5 times a week. You know, and there's variation in dosing, but vitamin D, like it's super critical, you know. People think it's a vitamin, like we said in our last talk. It's not, it's a hormone, you know, it does everything. You know, cholesterol is super important. You know, it's unfortunate that the statin drugs have kind of like, you know, they took over the pharmaceutical market. You know, everyone's on a statin. And then what happens to people's hormones? They tank. They can't produce hormones without having, you know, a really good, healthy cholesterol. But like you said, healthy cholesterol is key, you know. Yep. Ayana here, she says she loves vitamin D. Yep. Who doesn't? After working with me, of course she'd love vitamin D.
Yeah, and I think that, fits perfectly with how we actually, counsel our GLP patients when they're eating less because of these medications, cutting their caloric intake. Of course, they're
Mhm.
not going to get those nutrients and vitamins like we were saying with the leaky gut, everything. So,
Mhm.
I mean, we're always recommending the utmost important vitamins, vitamin D, calcium, B vitamins, anything that's not going to be, might be cut or they might have less of because now they're eating a lot less. So, it's important to not just remember, okay, you're gonna eat less and lose weight. There's, you got to support your body on a cellular level too.
Exactly. Yep. That cellular nutrients is super, super critical. You know, so your zinc, your copper, your magnesium, like all of that stuff is so important, you know, whether you're on GLP-1 therapy or you finished and now you need some type of maintenance schedule or maintenance, you know, springboard to kind of keep you where you want to be, to keep you optimal. Yeah, you have to support your cells on that cellular level. You have to make sure you're supporting all of the metabolism that goes through the cells, you know. Yeah. Any other questions or comments or ideas? Anything that you guys have run into that you think, you know, you maybe just want to mention?
I think we really touched on everything. There's a lot that encompasses GLP and the trend and where everything is going. But
Mhm.
I think remembering that, these are just a tool to help patients. And once they utilize this tool, it's time to take those next steps, such as hormone replacement therapy, fixing other comorbidities, leaky gut. It's important to just view it like that. It's a tool to help you, but it's not the end all be all. And these our patients, we're helping to fix everything.
Yeah. And I think, you know, a motto that we have here is that, you know, convincing patients, convincing our clients that their bodies can do what they're supposed to do. You know, it doesn't always have to rely on medication or you know, some type of like miracle drug. Your body can do what it needs to do. Your body can maintain optimal health and wellness. You use the tools to get you to where you want to be, and then your body can take over as long as you give it the right things. You give it the right nutrients, the right foods, you know, the right vitamins, the right supplements. Your body can maintain that on its own. Yeah. Can you remind us what what states Olive Tree is licensed in? Sure. So Olive Tree is currently licensed in 9 states, including New Mexico. The two that we are limited when it comes to our shipping is Ohio and also Texas. Texas, we can't ship sterile products to Texas. Ohio, we cannot ship any products to Ohio, but we have licensure in that state. And that's moving. We're doing a lot of things here at Olive Tree so that we can expand our scope of practice. But everything takes time and patience. So eventually we will be able to ship to clients all over the United States. But until then, we're serving our limited capacity, and we're doing it to the best of our ability, and we're doing it exceptionally well. Yes. Well, friends. Sam, thank you for joining. Emmanuel, thank you for joining. Ayana. And this is definitely recorded. We will be able to share this information in little clips, on our different media. And we look forward to the next one. We do this once a month. Typically we do this once a month on a Thursday, the third Thursday every month at 11 a.m. And so that is that. And until then, if you need any other information, you know where to reach me, the Queen of Compounding, Dr. Romero. He's always here at Olive Tree. We are here to serve our community and to do that faithfully, wholly, trustworthy. We do not participate in anything that's illegal. And we know there's a lot of things happening around the practice of pharmacy that is just not okay. We don't do that. We are here to optimize the health and wellness of our patients. And we do that by abiding by the law, doing it within the confines of the rules. And we have a Scout's honor to practice pharmacy in a certain way. And that's what we're here to do.
That's
So
correct.
thank you. And we'll see you on the next one. Take care. Bye.